Hi, today is 19th May 2023, the World IBD Day. We at Narayana Hospitals are committed to serve our patients with IBD and to raise awareness in the community about inflammatory bowel disease. Inflammatory bowel disease, as we call IBD, is basically inflammation of the bowel, where our bowel gets red, inflamed and ulcerated. It is an autoimmune chronic illness where the immune system gets dysregulated. The exact cause is unclear, but it is known to be genetically predisposed over and above the environmental factors, the gut infections, the antibiotics and the westernization of diet has known to play a role in triggering IBD. In India, it was earlier considered to be a rare disease, and most of the children or adults with Crohn's were treated as tuberculosis, or blood in stools were treated as dysentery. However, it is now being realized that inflammatory bowel disease is rising in South Asia, especially in India. 25% of the IBD are less than 20 years of age, and it is being commonly recognized in children now from age of around 6 months to 1 year to 5 years to 10 years. Basically, the theme for this year is that IBD has no age. So we all need to be aware of inflammatory bowel disease in our community. It is basically of two types: ulcerative colitis, where it involves the inner lining of the bowel and leads to inflammation and ulcers in the large bowel and presents as blood in stools. The second type is Crohn's disease, which involves the entire thickness of the bowel, and it can lead to chronic fever, it can lead to pain abdomen, it can lead to diarrhea and chronic weight loss in children or adults. In few cases, 10 to 15%, we cannot differentiate between the two and we call it indeterminate colitis. So if any of you is suffering from any of these symptoms, you must consult your pediatric or adult gastroenterologist and get yourself screened. Your doctor normally takes an entire history and based on the history advises you few blood investigations which find out the inflammation of a body. It is followed by upper GI and lower GI endoscopy, and in few cases we also need a radiological imaging like a CT scan or an MRI to know the extent of the disease. It is a controllable condition where the immune system is dysregulated. So we need medications to suppress this immune dysregulation. So the earlier the treatment is started, the better the prognosis. So we must not delay the diagnosis and the treatment, but also understand that this is a waxing and waning illness. So the patient needs to be on a continuous follow-up. Diet has an important role to play in IBD. It has been increasingly recognized that westernization of the diet, the artificial sweeteners, the processed foods that are being used in the Indian community are leading to rising incidence of IBD in our country. So let us all get together on this day to make people aware about inflammatory bowel disease and help in early diagnosis.